Hi guys, quick video about mold. Mold toxins are a big deal. Mold damaged buildings are everywhere. I think a third of buildings in the United States have been mold damaged, are the estimates from the Housing and Urban Development. You have to treat mold if it's affecting you. Mold is a toxin. Your immune system can react to that. The toxin itself can create inflammation, and the immune response can create inflammation. So there's a whole bunch of things that need to be done. Not being in a moldy environment is important, and a lot of people, they never get past that step because they get so over-focused. Binding up molds is critically important. Daily binder works really nicely. There's natural things like zeolite. I like biotoxin binder from Cellcore. But if you'll take a binder, you also have to have a bowel movement in order for the binder to work. But you got to take binders. Taking something like a TUDCA to help dump more bile into the intestines is useful. Taking things that upregulate liver function, conjugation, glutathione, all of those things are important for mold. You also have to pay attention to the immune function with respect to mold. And what you'll find is that if you have mold toxin illness, you often have immune dysfunction. That's one of the things that mold toxin causes, and therefore you'll have infections. So it's important to recognize that these things go together, and the symptoms that you're going to experience, some will improve just by taking the binders, just by detoxifying. Others might not, because you have, beyond the immune dysfunction caused by the mold and the toxins from the mold and the inflammation from the mold, you now also have microbial burden that's causing some of your symptoms. It's a complicated issue, but it can be treated.